Hello, Marcus Boston. Quick video today, and we're going to talk about hypothermia treatment in HIE, or hypoxic ischemic encephalopathy. Now, I'm talking about this today because I've had individuals who've contacted me and talk about their baby having to have hypothermia treatment and why it can be important from a medical legal standpoint, especially in the context of HIE. Now, if you're here, you probably already know that HIE is hypoxic ischemic encephalopathy, and in its simplest terms, to understand this condition, it is a reduced level of blood and oxygen that can happen during labor and delivery. And because of this reduced level of blood and oxygen, the baby can suffer a brain injury, okay? And so when certain criteria are met, doctors can move to a hypothermia or a cooling type of treatment. This is something that has been being used now in some places for babies with HIE. And the goal of this hypothermia treatment is to essentially cool the baby down. And it is there to attempt to lessen the severity of the brain injury. Remember, I said HIE, that is essentially a brain injury. And so when the brain is injured and certain criteria is met, sometimes doctors and medical professionals, they will move to this hypothermia treatment to try to slow down the injury or to try to deal with the severity of the injury. Now, as this hypothermia cooling is going on, doctors, they can also provide other treatment options to a baby that is dealing with HIE. If there's any type of kidney or liver issues that may be there, if there's any heart issues, if there's any other types of medical issues that may be going on during this treatment, doctors and medical professionals, they may be able to provide other treatment there too. Breathing, for example, that's also something that may be dealt with through ventilators and artificial methods of breathing. So the purpose of this video today is to help you understand from, like I said, a medical legal standpoint, hypothermia treatment, why it is important in some cases for babies who have suffered HIE, and just trying to help you understand more about the condition. If you're here because you have questions, maybe you're watching this video because your baby had to have hypothermia treatment, or you have questions about HIE, or you're trying to figure out, okay, does my baby have this diagnosis because of something that the doctors or the hospital, they failed to do? Maybe you have these types of questions. If you would like to speak with me further about what you've got going on, there's a telephone number on the screen. Go ahead and pick up the phone and give me a call. Now, I also have one more thing I want to remind you of. Because this video is on the internet, sometimes we have individuals who will contact us and they are not in the state of Maryland. I practice law here in the state of Maryland. And so, or I should say I practice law in Maryland. I'm not in Maryland right now, but I practice law in Maryland. And if you are not in Maryland and you have questions and there are some things that we think we may be able to assist you with, what we have to do is use what we call local counsel. In other words, we will have to use an attorney in your area, your state, your jurisdiction to help with the case. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law in the state of Maryland at Boston Law Group, LLC. And we will see you next time. Take care and enjoy the rest of your day.